The disorder that I chose for my teaching project is called Neurodegeneration with brain iron accumulation, or NBIA. So my practicum was on a pediatric ortho-neuro floor, and when it came to choosing my teaching project topic, I spoke to my preceptor about different cases that we had seen that were things I may have never heard of. And then I asked her if there was anything very different than what she usually sees on the floor. She told me about one of her coworkers that we had been working with that night who had a patient with NBIA earlier that week. I unfortunately had not seen the patient, but my preceptor told me about how the nurse was very lost when this patient presented with all of the symptoms, and no one on the floor, not even the charge nurse, had ever seen a patient with NBIA, so it was definitely a learning moment for them and something very different. So let's start with what is neurodegeneration with brain iron accumulation. According to the National Institute of Neurological Disorders and Stroke, NBIA is, quote, a rare inherited neurological movement disorder characterized by an abnormal accumulation of iron in the brain and progressive degeneration of the nervous system, end quote. There are 10 types of NBIA. All are caused by a genetic defect. The disorder causes excess iron in the basal ganglia, which helps control movement. Symptoms vary from patient to patient and usually begin during childhood. These symptoms include dystonia, which is muscle rigidity or involuntary contractions resulting in abnormal posture, dysarthria, which is slurred or slowed speech, choreoathetosis, which is involuntary jerky muscle movements, spasticity, or sudden involuntary muscle spasms, ataxia, which is the inability to coordinate movements, and walking on the toes. Some patients do experience a decline in cognition, such as confusion or disorientation, stupor, seizures, and dementia. Other patients do experience visual changes, which is due to optic atrophy and retinal degeneration. To diagnose NBIA, a brain MRI is usually ordered to rule out any other neurological diseases or disorders. As you can see in the photo to the side, the white arrows are pointing to the basal ganglia, which again is where the iron deposits accumulate in the brain in a patient with NBIA. Due to the iron deposits in the basal ganglia, the scan usually resembles that of a tiger's eye in that area. Something that I found really interesting when I was searching NBIA was that all of the scans really do have this eye of the tiger presentation, as they like to put it, and some of the patient scans look like a tiger's face in the entire picture, not just in the basal ganglia. So that's something that's very distinguishable in a patient with NBIA. In addition to that, they will usually do genetic testing since it is a rare and neurological genetic disorder. PCAN, or pantothenate kinase associated neurodegeneration, is the most frequent gene that is defected. And also, of course, it is symptom based since all the symptoms can be so many other things. But once you combine the symptoms with genetic testing and the MRI scan, providers can usually diagnose NBIA at that point. So as nurses, of course, we are not obligated to be able to interpret MRI and imaging scans of the body. However, I do enjoy looking at them and knowing what may be normal or what may not be in the big picture. So this picture is showing a normal MRI on the left side versus that of a patient with positive PCAN defect, and you can see the eye of the tiger presentation there on the right again. So treatment does vary amongst patients based on the presenting symptoms. There unfortunately is no cure for NBIA, so treatment is palliative or supportive care and may focus on physical or occupational therapy or speech therapy. For example, in symptom-based interventions, if the patient presents with dystonia or spasticity, there are medications, deep brain stimulation, and botulinum toxin injection options. In addition, medications that bind iron may help slow down the progress of the disease since it is an iron accumulation disease. Due to its progressiveness with aging, most patients do alternate between rapid declines and stable periods of symptoms. Okay, so here's a list of the later symptoms that may present in a patient who has already been diagnosed with NBIA. Take a quick look at them, and if you remember the original manifestations when someone is first diagnosed with NBIA, these all included interferences with muscle movement, nerve connection, cognitive development or impairment, and also the optic nerve. So when you take a moment to think about that and address it to this list of later symptoms, you can definitely put two and two together of how these are occurring. So for example, due to ataxia or spasticity and the other muscular impairments, that can be leading to the trouble or inability to walk, difficulty swallowing, respiratory infections, and let's go back to the trouble or inability to walk. A lot of these patients with NBIA will eventually be in a wheelchair, and now if we think about someone being in a wheelchair, that may lead to the respiratory infection, skin breakdown, blood clots, because they will not be able to move on their own as adequately as we all may wish, and what our normal may be. And then of course, blindness is coming from that optic nerve atrophy and retinal degeneration. So when it comes to nursing interventions, let's make sure to be moving these patients frequently on the clock. Let's also be checking their skin for any breakdown. We need to ensure that they are compliant with physical, speech, occupational therapy, and ask them if they have any pain or discomfort. Of course, it must be so difficult to have a disease that you know has no cure. So different things can help them out in different ways. Okay, here's some review questions. NBIA causes accumulation of what in the brain? Question 2. True or false? All patients with NBIA experience cognitive decline, such as confusion and stupor. 3. Chorioathetosis is defined as 4. An 8-year-old male patient presents to the ED with his parents, and the nurse is suspecting NBIA. Which of the following symptoms may he be presenting with that makes her believe it is NBIA? Select all that apply. And 5. A patient is diagnosed with NBIA after review of symptoms and finding eye of the tiger presentation on his MRI. What interventions should you as his nurse expect for the provider to request? Select all that apply. Thank you.